Welcome back. Want to get rid of all that unwanted flab? Now with the new ultrasonic liposuction technique, you can lose the fat without the pain. But at what cost? Here to give us the truth about this new procedure is New York plastic surgeon Dr. Thomas Loeb. Thank you for joining us, doctor.
Hello, hi, thank you.
First of all, why don't you explain the difference to us between the ultrasonic liposuction and regular liposuction?
Well, it's the way that the fat is removed. First, with regular liposuction, it's done with a mechanical process. A vacuum actually pulls out the fat cells, and they're evacuated that manner. With ultrasonic liposuction, the ultra-high frequency waves are put through the tip of a titanium cannula. They liquefy and sort of explode the cells, and then a conventional liposuction is used to sort of clear the liquid exudate that forms.
Now let's take a look at this. We're watching some portion of this procedure. What's going on now? Is the skin actually ever cut?
Yes, it is. What he's showing you here is this is a method of loosening up some of the tissue underneath. This is not the most traditional ultrasonic liposuction. That's done with a cannula, more like a cannula that has like what he's doing now. That's the ultrasonic liposuction that's going on right now.
Okay. And again, the procedure is so you are actually using this instrument to go into where the fat is stored in the portion of the body that you want it removed.
Right. I'll just show you these instruments briefly. I'll bring them up here so you can see that fundamentally this is a traditional liposuction cannula and this is a similar sized ultrasonic cannula. And basically, in both cases, the incision is small. It's a little bit bigger incision when you use the ultrasonic liposuction. But through the ultrasound, through this tip, obviously connected to some instruments back here, high-frequency waves break the fat cells. But then they still have to be vacuumed out. So usually this is done in conjunction with this. I think that's one of the things that's been misleading to the public. We're still using conventional liposuction at the same time.
Oh, you are?
Yes.
So when we say that you have the ultrasonic procedure, that means you're having actually two procedures at the same time.
They're usually using both tools. I would say that 99% of plastic surgeons who are using ultrasonic are still using at the same procedure at the same time. They're using some conventional liposuction too. So you have to be cautious because a little bit of this is kind of marketing angles, and so the public should be sort of buyer beware.
That was going to lead me to the next question. Well, then what would the advantage of the ultrasonic liposuction be?
Well, they're still trying to prove, there's only been in this country about 2 years, and we're still trying to find out what the advantages are and the disadvantages. We think right now that this is a better method for very fibrous areas, maybe men with love handles. It's a very fibrous area. Some patients maybe with their chest, gynecomastia patients, that's when their breast is too big and it's very fibrous, the tissue. And in some larger patients, it may be better because there may be less swelling with it and less blood loss with it. That still remains to be proven.
So those people and the conditions you just mentioned would be a greater candidate for the ultrasuction.
I think it has more of a role in those patients. But again, your surgeon's probably going to do some of both.
Is there any difference in the recovery time and in the pain element here?
There hasn't been any proven difference in the recovery time. Theoretically, maybe there's less swelling with the ultrasonic liposuction, but it has not been proven.
Up until this point now, who have been the people who've wanted to try the ultrasonic? People that are heavier than most?
I think up to this point, probably people that want ultrasonic are people who've been thinking about liposuction for 2 years, and then here there's something new like a laser or an ultrasound, and then they kind of get maybe suckered into going into that doctor's office because he's marketing ultrasound. And I don't think that's the way they should choose a doctor.
How should they choose the procedure and the doctor?
Well, they should choose, the surgeon needs to be qualified, probably a board-certified plastic surgeon, qualified to do the procedure. He needs to be trained in it. It needs to be done in a facility where it's a proper accredited facility and by real anesthesiologists. And you need to be able to go in the doctor's office and talk to him about it and make sure he's not running a factory and that you're comfortable with it.
Okay. Doctor, thank you so much for giving us the inside scoop on this, the real story. Thank you.